All right, let's go ahead and get started. Maybe some more will trickle in a minute, but
Okay.
we'll go ahead and get it going. Today we have with
Okay.
us Dr. Bennett Chip Tucker. He is the East Central Alabama AHEC Scholars Coordinator, and he will be talking with us today about. Sorry, let me just had an email come up. Okay. Chip, are you ready?
I'm ready. I'm ready. Okay. So this is for all the budding epidemiologists that we have as in our AHEC Scholars Program. And I thought we might start with just some basics today to show how, just in case you are setting up in your new rural practice, you might want to do an assessment on the health needs, perceived health needs of that community, or you might just want to write a scientific article. So I thought we'd start with some basics there, and happy to have you. And let's give it a go. We're going to talk about the EDP formula, and let me go back one. That would stand for. Can you hear me?
Will you share your screen with us?
Okay. Okay. Now, let me do that. You still there?
Yeah, I'm still here.
Okay, let me share it. I
I can
hit
also share if you
I
need
hit
me.
that first, but let me see if I can. Now, can you see it?
Not yet.
Not yet.
Okay. You have it now?
No, not yet.
Okay. There?
No.
Okay, so the sequence, I should hit the PowerPoint, the share first and then the PowerPoint, correct?
Yes.
Okay.
Share screen.
Do you have multiple screens or do you only have one?
I have multiple screens.
You may want to make sure that the appropriate screen is selected.
Well, I just have a viewer. Oh, okay, okay. I see what you're saying. Okay, let's do that. Let's do that. Okay, share. And what about now?
No.
Here, Chip, I'll share it.
Okay, you share it for us.
You just tell
That's
me.
good.
Okay.
So we seen it now?
Give me just a second.
Okay. Okay. Yeah, there we go. Okay. Thanks for that. We're talking about a formula called the EDP. That's exposure, disease, or outcome in a population, a formula used to establish a study question. Can we go to the next slide? Yeah. So you should know something about the person that's talking to you. So I want to run through that very quickly. As far as what brought me here, I started at Gaston State Junior College, went from there to UAB, got a BS in biology, a minor in chemistry. That's what we all did at the time if we wanted to go to dental school, which I did. Did 4 years there and then trained in fixed and removable prosthodontics at the VA Medical Center in Birmingham. From there, I went to 15 years of the private practice of prosthodontics in Gadsden, Alabama. Picked up a peripheral neuropathy and autoimmune peripheral neuropathy. Basically, the left hand went completely numb overnight. And I figured since people really wanted their dentist to be able to feel the handpiece when it was turning 200,000 RPM, I would need to sell the practice, which I did. Did some financial things after that, and then taught gross anatomy and physiology, gross anatomy at Gaston State Junior College for 7 years. From there, went to Westbrook Christian High School, taught AP biology and chemistry, and coached football and basketball for 1 year. And then I started at Huntingdon College in Montgomery, teaching healthcare management, healthcare ethics, and research methodology in their evening bachelor's program. Next frame, please, ma'am. I also had some time with the United States Army, with the Alabama Army National Guard. This particular slide is a picture from a 1985 mission to the Republic of Panama. So these things sort of affect the way you think. Next slide, please. Thank you, ma'am. So you might not know it, but those of you in Birmingham, and for sure everybody in Alabama, can be proud of some things, of some research that's been done in our state, particularly Southern Research Institute I'm talking about. I was on a research team there. They put me through school basically because I didn't have any money. So they paid for 6 hours of tuition every semester. And in 1976 and 77, we were doing testing on chemotherapeutic drugs for leukemia, basically the children's leukemias. We were using the AKR mouse to do that. And some of the drugs that we pioneered, you still hear about. And that's why I have From the South Side to the World, vincristine, prednisone, cytoxin, methotrexate, adriamycin, and 5-fluorouracil. Anybody recognize the uracil part right here? Students, does anybody recognize that? They're probably muted. Of course, this is part of RNA, and we know that along with cytosine and guanine and adenine, this makes up RNA, and it's different in DNA because instead of uracil, you have thymine. But basically, 5-fluorouracil, you have a fluorine atom on the 5th carbon in the fluorouracil molecule. So this slide is here to show the connection between the lab research and population level research where you're dealing with human being participants. Next frame, please, ma'am. Thank you. So y'all going to treat patients, right? So, and you'll develop your own treatment philosophy. This basically is mine. I actually found it along the way. And this is a quote, oddly enough, by Coach Jimmy Johnson, who coached the Miami Hurricanes and the Dallas Cowboys. Basically says, treat a person as he is and he will remain as he is. Treat a person as if he were where he could be and should be, and he will become what he could be and should be. In other words, when we treat patients, do we have that empathy to realize they're not there yet? Maybe in all possibilities, they're still a project. They're still at work, getting to where they want to be, and we should be empathetic with them. Now it says he because he coached the Dallas Cowboys. I don't think Coach Johnson had the dance moves to teach the cheerleaders. So it says he instead of she, okay? Next frame, please, ma'am. So if we look at the research process, and this is always the same, if you wanted to write a research article, you would start with the development of a study question, and that's what we're talking about doing today, using the EDPs to do that. You would next select a study approach. I will say, sometimes when you start your study approach, you have to go back and you have to rework your study questions. So there might be several iterations because it might prove when you take a look at the approach that it's not feasible, not possible to do. But after you select your study approach, you design your study and you collect the data. Now, how many participants are you going to have? Where will they come from? How are you going to collect your data? Are you going to collect it with an interview process, in-person interview, a telephone interview? Are you going to have extra assessments to go along with it? So as you design your study and before you collect your data, these questions come into play. After that, you will analyze your data, and there's a lot of software to help you with that. And then you report your findings. And in the research community, if you don't report your findings, it is as if it never happened. So this is the way that research articles are the way scientists communicate with each other. So this is a research process. Next frame, please, ma'am. Thank you. Why would you do research? I mean, probably not going to get rich. But what you find is that researchers have a passion for what they do because they realize what they do is bigger than just themselves. They reach more people than just themselves. But there are several reasons you might research after you get out of your program. You might move into a new community, a rural community, we hope, hopefully in Alabama. And you might want to know what are the population needs of this particular area. We did a thing called community health evangelism, SCHE, you see at the top there on the top right. And that's basically where you go into a village, and we went into South Sudan, also into Serbia with the Romani, people would call them gypsies, I don't, the Romani. And what you do, you form a committee from the endemic people, and then they select CHAs. The CHAs are the people that will go into the homes and assess the health needs. And it's really nice because you have their own people working with them. It's not like an outside agency. So needs assessment. Secondly, risk assessment. What are the things that cause illness in that area? The morbidity, death, the mortality, or disability, which really disability is thought of as a living death. Nice to be able to do a risk assessment. Applied practice, we're all the time constantly looking at what we do clinically. Can we do that better? Okay, can we do that better? For example, why does it take so many hours to get from the ER to a hospital bed? Why does that happen? It's nice to know why and take a look and research these things. Also, outcomes evaluation. If you do an experimental study, maybe it's a new therapeutic drug, it's nice to know how much success you had with your intervention. The real term we use there is efficacy, which is basically the number of people in the control group that had a bad outcome, that would have had a good outcome had they been in the intervention group. So these are just some reasons that we would research. Another one might be your mentor or your attending said, do this. That might be another reason you might end up doing a research article. Next frame, please, ma'am. So when we talk about EDP, this is the E. These are the exposures. And we see it's divided up into several categories. We'll talk about just a few of those as we go through. Socioeconomic status, we know that affects the patient's ability to seek and receive health care. Income, wealth, those are factors. Educational level, all these play in. There are some things that they can't do anything about. Their age, it is what it is. A hot button for us right now in the United States is immigration status. That is thought of as an exposure, because when people come across in our country, we don't really know what healthcare they've had. We don't know initially what they need. So it is thought of as an exposure, the fact that they are immigrants seeking to live in the United States of America. What about marital status? Well, maybe the husband works for the sheriff's department in some county, and maybe he has health insurance, but it does not cover his wife. So she might have trouble receiving care because sometimes they just don't have the money for it. Health-related behaviors, we see some things that people do to themselves. We see alcohol use, tobacco use, sometimes unprotected sex. We see things like, what's their diet like? Or do they eat healthy? Exercise. I mean, do they exercise? Do they go to the gym? Do they think that laying on the couch with a 12-pack of Coors and a clicker is exercise? Well, we know it's not. Okay, we know that's going to lead you to some pretty bad health dilemmas and maladies. Are they a hygienic person? Are there practices in their religion that would limit the amount of health care, certain procedures that they could get? As far as their health status, what's their nutrition like? What's their immune status? do they come to our clinic immunosuppressed for a number of reasons? Or do they have an autoimmune disease, perhaps, like RA, rheumatoid arthritis, systemic lupus, erythematosus, fibromyalgia, some of those. Also, type 1 diabetes, we figured that out, that it's autoimmune as well. Well, there are some things here with the health status we can't ever take out of the equation, right? Genetics and stress, what stress does to us. And also the genetics, they are what they are. Now, some patients will come in with a congenital defect, maybe an anatomical defect. Maybe it's not complicated like tetralogy Fallot, where there are 4 cardiovascular defects. It might be something a little simpler, maybe a ventricular septal defect. But these are defects that do affect their health care. Comorbidities, what are the existing health problems that you perceive when you take your excellent history? As far as environmental exposures, there are a lot of things here. What happens in natural disasters? We know healthcare becomes a real dilemma there because hygienic practices have to go out the window sometimes, and clean water, that sort of thing is a problem. Have our patients or our participants traveled? Have they gone out of the country? The question is, sometimes they'll bring something back with them, and you discover that as you work with them. There are diseases that happen in altitude that don't happen otherwise. Acute mountain sickness, high altitude pulmonary edema, high altitude cerebral edema. These are things that happen only at high altitudes. Radiation sicknesses. Drinking water, another thing. In South Sudan, we found that the people had wells, and the cows were just walking around the wells, and we encouraged them to get a fence around that well so they could have cleaner drinking water. These are it's not a total list. It's just an example of exposures that our people. So it's not like we've been exposed to a particular bacteria or a virus. All these things are exposures. Next frame, please, ma'am. Okay, obviously this is not a complete list either, but these are just examples of diseases that would fill that D category in the EDP formula. Things like candidiasis, from Candida albicans, people will call it Manilia or thrush. You see it in their mouth, on their tongue is a white coating. Maybe after systemic antibiotics, they get an opportunistic fungus called candidiasis. We see other things, syphilis, for example, caused by spirochete. Other things are called by spirochetes, different ones like Lyme disease. We might talk about that a little bit more in a little while. Tuberculosis, there will be outbreaks of TB across the world. Under the non-communicable disease category, we have some things that we treat but we never cure. Hypertension, diabetes. We see asthma, and some people they never completely outgrow it, but it might be less when they're as they get a little older. Of course, we know a lot about cancer oncogenes now with breast cancer, so great strides have been made there. Your patients, sometimes when they hit around the age of 42, you'll notice they're looking at their paperwork like this, really close, because they have trouble seeing close. They read their menus like that in a restaurant. Well, their lenses have become cloudy, and they'll have them replaced and replaced with artificial lenses. They can also around this age get a thing called presbyopia, which oddly enough is not limited to Presbyterians. Baptists can get it too. It happens to most of us, and it's just where we can't see close up. So this group will end up with readers a lot of times. Osteoporosis is huge, especially in the postmenopausal female, because what we see there is that when their estrogen levels drop out, I say estrogens because there are several different estrogens, then they will get osteoporosis. My mom's generation thought that they were exercising when they cleaned their house. They weren't. They should have been walking, and that would have prevented some of the kyphosis or the bent over appearance that we see from that age group. The neuropsychiatric disorder list is very interesting because some of these are relatively new. You might not know this, but the spectrum for autism was really developed in 2013. We know that Alzheimer was described by Dr. Alois Alzheimer in 1910, but we're still figuring out the dementias. We're still learning. Not long ago, the only way you knew for sure if somebody had Alzheimer's disease was to take a look at their brain, which you couldn't do until they were deceased. Now we have some other techniques. A lot of our country is on something for depression, and you will encounter these people. After the Vietnam War, around 1980, PTSD became a term. Before then, it was called several different things, starting in 1867 with railway spinal disorder, and it progressed through the years up to PTSD. We're still learning about that as well. And then we have a list of injuries that we can see, not a total list, but these would be under the disease category in the EDP formula. Next frame, please, ma'am. And when we talk about populations, you as a researcher, when you design your study, you will be in charge of this. You can make this what you want. Obviously, if you started out to study adults with diabetes, well, number one, we should say diabetes mellitus, right? Because there's another diabetes insipidus, which babies have. They don't retain water. Here we're talking about a blood glucose level problem, but you would not have a study where you said, I'm going to study adults with diabetes, because trillions of people, millions of people, where would you stop there? You would define that. For example, the individual is newly diagnosed with influenza at St. Mary's in Newcastle. You might define that even more by saying who were admitted to the hospital on a certain day or a certain week, and maybe were followed up by a certain physician. So you can qualify your population because you're in charge of the study. And by the way, people in South Sudan now or a lot of them are now in Uganda because of war, and they can receive health care there. Next frame, please, Ben. So this is just a list of potential study designs. If you decide to do a research study, what design are you going to use? We'll just briefly describe these. So you can use the EDP formula in these particular study designs. A case series is simply a description of people that are literally in the same boat. They have had the same surgery. They have had the same disease, the same exposure. Largely, it's about diseases, though. What do these people look like? How they act? What are the signs and symptoms? A case is one, and a case series is multiple cases. And to be in that study, they have to fit a real strict case description. A cross-sectional survey is a one-time, one moment in time event, and it's where you describe the exposure and or diseases in a particular population, but it's for one moment in time. So you can't say an exposure caused a disease with a cross-sectional study because there is no time element. It's one point in time. A case control study is basically where you look at exposures, like some of the ones we studied, in people with a disease, those would be the cases, and people that do not have the disease, those would be the controls. Once again, a real strict case definition. And you want your control people, participants, to be very close in age and other aspects as your cases, so the findings will be relevant. You'll hear about a cohort study sometimes, and a cohort study really is about just determining incidence, that is new disease, over time. 3 different kinds of cohort studies. The prospective and retrospective cohort studies really compare people that have had an exposure to those that don't. But a longitudinal cohort study doesn't have anything to do with exposure. It's just because you're studying somebody just because they're in a group of people that you can follow forward and look at over time. So you've got a baseline evaluation or exam, and then you will follow them incrementally through the years. That's a cohort study. The experimental studies, And you will hear things like single blind and double blind. That has to do with, do the participants know if they're in the intervention group or the control group? You'll also hear placebo group for the control group. A single blind study means the participants don't know. A double blind study means that the participants and the researchers that deal with them, that meet with them, neither one of them know which group they're in. Single blind and double blind studies. Obviously, some researcher up the line knows, but you're comparing the outcomes. Did I have a good outcome with my new drug, or did I not? Did the control group do just as good? These are the things you determine in an experimental study. There is a huge ethical component with experimental studies. You have more ethical concern with these studies because you are literally determining what happens to the people. In other words, they would have had that intervention had they never met you. And then the correlational studies, not a lot of qualitative studies done now. Correlational studies are ecologicals when you're looking at average levels of exposures, maybe over several different populations. And then a literature review is when you study all the articles, and I say all the articles, so that might limit your study question in the numbers that are reasonable. You study what's in the existing literature. And with the meta-analysis, you actually come up with a summary statistic. Okay, y'all, here's all these articles, and here's what they mean. You come up with a summary statistic with a meta-analysis. Next frame, please, ma'am. So this is just illustrating a pretty nice little picture to have when you're deciding how you're going to decide your population, how you're going to decide your participants. If you select them based on disease status only, and you don't need a comparison group, you're looking at a case series. If you need a comparison group, you're using a case control study. If you select your participants based on exposure status, you're looking at a retrospective or a prospective cohort study. And then if you select your participants who represent a population, one point in time, that means cross-sectional study. If it's multiple points in time, if you assign the exposure, that's an experimental study. And if you're just doing an observational study where you observe the people, you don't do an intervention, then that would be a longitudinal cohort study. Next frame, please. Here, there's just some study goals. We won't have to cover all of them. But maybe you wanted to look at incidence and prevalence of a particular disorder in the community in which you set your practice up. You can do that. What are their healthcare needs? What are risk factors for a particular disease that you see that's prevalent in that area? Incidence, once again, is new disease. Prevalence is existing disease. Maybe you wanted to check your new intervention, your new drug. Well, a lot of factors, right? Do I give it PO by mouth? Do I give it IM, intramuscularly? Do I give it IV, intravenous? Or do I give it sub-Q, subcutaneous? And then, when we decide the delivery method, what dosage is optimal? So these are all things that can be determined with an experimental study. And maybe we want to check to see if that intervention is as successful in one community as it was in the initial community. Maybe we're just going to put things together from existing literature like a meta-analysis, and that is synthesizing existing knowledge. These are just several study goals. Why might you research? Maybe you come upon a topic that's intensely personal to you. Maybe you see an injustice that should be written about. These are reasons you would do a research article. Next frame, please, ma'am. Okay, so I just wrote a couple of study questions for several different study types where you would see the EDP formula. Here's one. It's vincristine prednisone regimen, a vincristine prednisone regimen, therapeutic for acute lymphocytic leukemia in Canadian children under the age of, I think it's 4. Well, okay, what's the exposure? They were exposed to this intervention, right? What's the disease? Acute lymphocytic leukemia. What is the population? Canadian children under the age of 4. So you see EDP formula. What about this one? Was immigration status related to a diagnosis of PTSD in immigrants coming across the U.S. southern border from Venezuela on 4 July 2022? Well, this specific data here tells you it's a cross-sectional study because it's a particular point in time. Immigration status would be the exposure. PTSD would be the disease or disorder here. Next frame, please. A case study. Here's an example. Describe the gene change that causes Tay-Sachs disease in patients from Eastern and Central European Jewish communities. Also, oddly enough, you might need to know this at some point for a board question. It also involves the Louisiana Cajun communities and the French Canadian communities from Quebec. But anyway, exposure would be the gene change. Tay-Sachs would be your disease, and your population would be patients from these particular Jewish communities. That would be an example of a study question for a case study. Next frame, please, ma'am. A longitudinal cohort study. Remember, we're looking for new disease incidence over time. And, you know, I've tried to make this relevant for us, like the immigration question. Describe the pathogenesis of a group of Alabama Crimson Tide running backs from the mid-1980s that contracted amyotrophic lateral sclerosis, that is ALS, commonly called Lou Gehrig's disease, after their football careers ended. Well, here, the exposure and the population are the same thing. A group of Alabama Crimson Tide running backs. You don't have to put that received head trauma because they all did if they were running backs. And then the disease was ALS. And like I said, the population is the same thing as the exposure. This would be a study over time. We'd say, okay, here's the way they are at their baseline. Let's follow the disease progression of the pathogenesis into death. These people, oddly enough, they lose their manual dexterity, weakening hand muscles, severe muscle cramps, and usually die within 5 years because their diaphragm will no longer work for the next breath. Next frame, please, ma'am. Okay, this slide is the last one, except for my credit slide. And I have it here just to illustrate the need for cultural sensitivity when you do research, to be honorable of the people, especially when you're international. These people, these two people and this one here, this are Romani. People call them the Roma Gypsies in Serbia. It's tough for them. They have 99% unemployment. So we went to study some things for them, help needs, business needs. And this is the pastor of the local community. This fella and these two, you might recognize this one, are from a church in Gaston, Alabama. But anyway, it's very important to be honorable of the culture in which you work. It's nice to have somebody there with you, like this gentleman, who can help you through that and say, no, you can't do that. Yes, you can do that. Next frame, please. A lot of what I gave you is from a book from Catherine Jacobson, Introduction to Health Research Methods. And it's a book we use, a text we use at Huntingdon College when I taught a research methodology course, research and its application in healthcare. So I'll give her credit for a lot of those charts. I would ask at this point if anyone has questions. Okay. Well, if you don't, you can do this. Should you decide, I'll give you this offer, should you decide to do a research study, why don't you send me what you're thinking? My email is ctucker at ctucker at, anyway, we'll get that to you. We'll get that out, Rachel. Okay, ctucker at ECAAHEC.com. ctucker at ECAAHEC.com. That's it. You never use your own, right? Anyway, send me your topic and we can maybe put it into a study question and help you get started should you decide to do a research project when you set up in your new practice. Okay? I've enjoyed my time with you and thank you very much for being here today. Rachel?
Yes,
I
thank
do
you,
have,
Chip.
if
for-
there is time, I do have a question if there is time.
Okay,
Yeah.
okay.
Yeah.
I would just love to hear a little bit. You were talking about the exposures about like immigration status and some of these factors which are kind of more current issues. I was just curious what you kind of see generally in the field as kind of current big areas of research or like up and coming research in the next 10 years, factors that are really being kind of a focus of exploration.
Well, that's really limitless. I would encourage you to go on PubMed. I don't know if y'all have used PubMed, but if you have, you know, now they've made that simpler. You just type in a disorder or disease and you get all these papers and you can look at it. Obviously, COVID, we're not finished with COVID. Some of the things that we think are done are not. Diabetes. I mean, we're still discovering. They've changed. You know, used to type 1 meant this, type 2 meant the age has nothing to do with it anymore. Now we have 1.5s, you know, so it's really come a long way. But you can just about pick anything. And once you go into an area in the world, you see what's pertinent for them. And you can work that way. It's I mentioned Tay-Sachs today, you know, very limited community. We might not have very many cases in the country every year. How did they determine that you have a red spot in the retina when you look at their eye? You know, somebody studied it. So you just pick any pathology you want to, and you just can't totally copy something somebody else has done. Obviously, you have a new perspective, you have a new time, right? But you can pick, you know, but I would say do the things that are start with the things that are intensely personal to you, what you see. And you'll probably see something I never would have thought about, you know, because you're in a different place and a different time of study. And, you know, use another thing, ask your mentors. Sort of a vague answer.
Yeah, no, thank you so much. That was helpful. I appreciate it.
You're welcome. You're welcome. Anybody else? Okay. Just send me those and we'll help you get started.
I had a question. I'm sorry for the delay.
ma'am.
I'm
Yes.
driving.
Yes, ma'am.
Hi. So I'm Ayana McDowell. And my question is basically you're when you're having like a hard time with like research in general, just because you can't find specific articles and stuff about what exactly you want to study, how do you go about that kind of like I guess jet lag, and I guess you have to, I guess I'm gonna answer my own question, but like kind of conduct your own research in a way, but then also like how would you go about doing that if you don't have those resources? Now, isn't there a process for that?
Yeah. Sometimes it's very simple. We might do something we don't get to do a whole lot, like walk in a library. They can help. Librarians generally on college campuses are very helpful. I would also ask your instructors, and I would also ask, I would also consult PubMed. Medline is part of PubMed. Go in and you can actually say, look, I don't want to pay. I'm a student and I don't want to pay for articles. So you can click a box that says, I only want to look at free articles, you know, and under a particular topic. I would like to look at articles maybe that have been done in the last 5 years or the last year or the last 10 years. And then you get a list of articles, but you won't read all the articles initially. You will start with abstracts. The abstracts is a synopsis of the article, usually written after the article is written. Okay, you do that because you can then see what you need to put a into a synopsis. But you'll read abstracts first. And if you see those that are interesting to you, that you think will fit in what you're researching, then you read the whole text. But you don't read the whole text till you've read the abstract first, because you're going to call out some things that aren't going to be pertinent to you. So I would start with the abstracts. Does that help?
May I?
Yeah, Becky. Hey, Becky.
Yeah. Hey,
Yes,
good
thank
afternoon,
you.
everyone. I might just add to that as well. So depending on what your discipline is there are probably programs for various like a pre-doc program, for research in particular. So if you have decided that you are going to do research and you're looking up this topic that you just mentioned that you didn't find any research on, obviously there's a gap in the literature and a gap in knowledge that needs to be filled. And so why not, you do that? If that's kind of what you're considering, why not you do the research and fill that gap in knowledge? But there are various programs. One of them that I just saw today was a pre-doc program from the Pharma Foundation. And it's really for you to be able to take a year off. They give a $60,000 stipend to do this type of research. You just have to write the application and have it, get the grant, the award. But I will just add again that there are multiple ways to do that. One other thing I was going to mention too is don't discount the people in your office and in your space about what ideas that they might have for research too. So quality improvement projects can turn into research projects, and there have been lots of conversations about how to divvy these up. But I will give you one example of adherence. So one of my mentors, his career is based on HIV, AIDS adherence to coming to appointments. And do those who come to appointments regularly have better success than those who don't? And how do you encourage those to continue to come to their appointments regularly scheduled? And so again, that is his entire career, research career is built on that. And it was because a nurse in his office started saying, these outcomes are better for these individuals who come to their appointments regularly like they're supposed to versus the outcomes for those that aren't. So think broadly, think widely, think about things that haven't been answered yet, and take off and go with that too. But that's all. That's what I'll add. Thank you.
Yeah, and she's right on point there, because a lot of what you will do is look at gaps, things that have not been studied in the literature. So that is exactly right. You look for things that just hadn't been studied yet, and don't think anything when you're brainstorming. Don't call anything out yet. Write everything down, and then things will start to make sense as you work through them toward your study question.
I'll also add that if you need resources from a financial standpoint, you can look on the NIH's website and apply for potential T32 grants. That's for grants for student learners at the graduate level. That's a good opportunity to explore if you really are interested in going down the research path. But just like Becky said, there are many programs out there that can financially support you. So if you're able to work with a mentor or an instructor and find similar paths where your research initiatives kind of align, sometimes that they can either support you in if they have their own lab, so to speak. So it really just depends upon what type of research you want to go down and pursue, whether you want to do like community research or wet bench research. It really just depends on what you're wanting to pursue. But I would definitely look from a financial standpoint, looking at T32 grants. Are there any additional questions? Well, I also wanted to inform everyone and just to send a reminder, one last reminder, so to speak, that our AHEC Scholars virtual networking event is going to be next Wednesday evening. This is going to be a really good opportunity where scholars from across the state can connect with one another and really see why they enter their career field for their own specified discipline, and give you opportunity to just reach out and see who else is a scholar across the state and just start building relational connections moving forward to both support your own learning and then to support the community as well. So we really encourage you all to attend that session, and you will also receive experiential hours for attending. So just be mindful of that. But if you are interested and have not registered yet, please register at the link that Rachel just shared in the chat. Registration deadline is April 1st. And the reason that there is a deadline of April 1st is we have a number of activities that we're going to be doing. And so we have to make sure that everything is logistically orchestrated prior to the virtual event. Dr. Remy, is there anything else you'd like to add in regards to that?
I guess the only thing that I'll add is this is a new opportunity that the scholars have asked for. There have been a few scholars who've approached us and want to do this networking across the state. And this has been designed and brought to us by scholars. And then Kayla put her amazing touch on it to bring it together in a way that is going to be so fun and unique to have a virtual networking event. So I hope that you all will attend, and I just think that it's going to be a great first time event that we hope to host, even maybe biannually. So even maybe twice a year that we would do this type of networking event. So thank you, Kayla.
Absolutely. If any of you all have any questions regarding the virtual networking event, please reach out. My email is kaylabdixon@uabmc.edu, and I will gladly answer any questions that you may have. And I hope you all have a great and happy Easter.
All right. Our last AHEC webinar is on April 26th, and it will be on QPR training for suicide prevention, and you'll get a certificate if you join and complete the course. It's with Dr. Angela Sullivan of the Alabama Suicide Prevention and Resource Coalition. So I'll drop the registration in the chat as well. And that is it for today, guys. I hope you had a great webinar. Yeah. Thank y'all for joining.
Thank you.